This clip has been created for learning and development purposes. It is intended to be educational and feedback is encouraged. This series of wellbeing clips for medical professionals are brought to you by the University of Wollongong. Studies have shown that doctors and nurses are a high-risk demographic for anxiety, depression, career burnout, and other associated mental health concerns. Causes contributing to this level of anxiety and fatigue are the long hours, difficult patient situations, and strained workplace relationships. The purpose of this series of clips is to introduce various coping mechanisms to manage work and life stress. These strategies have been researched and empirically verified. There will be 3 clips introduced during the program that can be accessed via an online platform. This clip will focus on the practice of mindfulness through meditation to reduce stress and anxiety. Firstly though, let's take a quick look at the effects of stress. We all know what happens when we start to feel stressed. Our breathing increases, our heart starts racing, and we might start to get a bit sweaty. This is the body's fight or flight mode being activated. Remaining in fight or flight mode for prolonged periods of time can have adverse effects on your health. Instead of interpreting the rapid breathing and pounding heart as signs that you're not coping and allowing stress to increase your anxiety levels, think of that pounding heart as your body preparing itself for action, and the rapid breathing as okay, as it's just getting more oxygen to your brain. A Harvard University study found that participants who were taught to rethink their stress response in this way were more confident and their work performance increased. The hormone oxytocin is commonly associated with happiness and human connection. Therefore, the release of oxytocin during the stress response can be interpreted as your body pushing you to seek comfort and support in others. It's probably safe to assume that there are plenty of medical professionals around you at work who are undergoing the same or similar levels of stress that you are. Engaging in peer support can not only influence well-being, but has been shown to increase employee improvement. The medical culture in Australian hospitals has attracted criticism from both inside and outside the industry. According to an article published in the Medical Journal of Australia, the health and well-being of junior doctors must be a priority for the medical workforce. New South Wales Ambulance has begun offering such peer support programs with over 100 peer support officers employed. By supporting each other, you can use human connection as a mechanism to combat stress. So, now that we've talked a little bit about stress, let's take a look at mindfulness as a strategy to help you deal with the ups and downs of life. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Meditation is an element of mindfulness that allows you to return to the present moment and try to find relaxation. Studies have shown that the practice of meditation is effective at reducing stress. Concentrating on and connecting with the present moment allows us to acknowledge that while we cannot control what happened yesterday or what will happen tomorrow, we can control our feelings in the present. Mindfulness is about changing the matrix. Perception is reality. If you change your thinking, you can change your behaviour and achieve a different outcome. For example, you're having difficulties with a toxic person at work who is making you feel that you aren't good at your job. Instead of letting their behaviour cause you anxiety, reframe it. Think of the person who is causing you anxiety as the one with the problem. If they're bullying you, then they're the one with the unhappy mind. And remind yourself of that. Reframe. Concentrate on yourself. You can control you. The scientifically proven benefits of meditation include a reduction in overall psychological distress and career burnout, and an increase in resilience. We will now run through a quick meditation to familiarise you with the practice. Before beginning, it is important to remember that this practice is about being kind and doing good, and asking what anger does to you and trying to avoid it. So, some tips before we begin are: don't get caught up in the how, just do. There is no one correct way to meditate. Check in with how you're feeling and focus on your breath when you feel your mind start to wander. Short meditations, such as these, can be done quickly while sitting at a desk or in a break room. We will now begin our quick meditation. Close your eyes and begin to breathe deeply, in and out, in and out. Turn off all distractions and move your attention towards the sensations in your body. Recognize where you're feeling tense and imagine that tension falling away. Focus on the air coming in and out. Notice how the air that you are breathing in is cooler than the air that you are breathing out. When you're ready, open your eyes. You've just completed your first short meditation. We encourage you to download an app called Insight Timer, where you can practice guided meditation and join closed groups. You can use this platform to connect with colleagues and practice group meditation. We hope that you have enjoyed this clip. Our next installment will focus on breathing techniques and gratitude.